Bismillahirrahmanirrahim. My dear students, I'm talking on the comprehension of the ECG electrocardiogram, which is a very much fruitful, beneficial, and a real diagnostic tool, the real diagnostic lines for the evaluation of the function of the heart, rather its electrical activity, and to see various abnormalities. It's a part second of my ECG series of lectures. In this much lecture, it will be my rather suitability to talk about the ECG waves and their abnormalities. P wave shows atrial depolarization. Its duration is 0.1 second, 2.5 small square, and height is 2.5 millivolt, 2.5 small square. Presence of P wave in ECG strip shows the sinus rhythm. Sinus rhythm means the rhythm which is taking origin from the sinoatrial node, the pacemaker having the particular cells in the right atrium. Abnormalities of a P wave. P pulmonale, this is a tall and peaked wave in lead 1 and lead 2 and 3 in right atrial hypertrophy. It's also known as a pulmonary hypertension. Then the P mitrale, it is a biphasic or broad P wave seen in left atrial hypertrophy as a result of a mitral stenosis. And they both are best seen in the lead 2. So P wave is a diagnostic for these two conditions, the cardiac pulmonary hypertension and the atrial hypertrophy as a result of the mitral stenosis. Yes, you are looking here how the P wave is being formed, how the electrical current is flowing, and you are shown here the vector, and you can see the formation of the P wave in stage 1, in lead 1, in lead 2, in lead 3, and AVF. And in this figure, you are again seeing what is its biphasic and tall in lead 1, lead 2, lead 3, and V4 and AVF. These are various leads in which the abnormal P waves, P pulmonale and P mitrale, can be seen. Inverted P wave. Inverted P wave may be present in normally lead V1 and V2. In dextrocardia, when the heart is rotated to the right side of the thorax and its apex is felt in the right fifth intercostal space, and it can be because of incorrectly placed electrodes. And you must be very much clear that whenever the electrodes are not placed in their genuine positions, even then the wave contours can be abnormal, and it can rather deceive the physicians to title the abnormalities. So while performing the recording of the ECG, placement of the electrodes is very much essential, as I have told in my previous sitting. Well, these are the records, and you're looking here in AVRP, in AVL, and in AVF. For example, now I'm talking on the QRS complex, which is rather the ventricular depolarization. It consists of three waves. Q wave, which is a negative, R is a positive, and S wave is again negative. QRS complex represents the ventricular depolarization. And keep in mind, there is a generalization. One should be very much clear. इस बात को बच्चों ज़हन नशीन कर लेना depolarization is an electrical change and it is ever preceding the mechanical change which is known as the contraction. Depolarization is an electrical change and contraction is a mechanical change, and it's a law that the electrical change ever comes ahead of the mechanical change. Its normal duration is about 0.08 seconds, less than 2 small squares, and height is about 5 to 20 small squares in terms of a voltage. It's a wide complex because it masks the atrial repolarization. I have already told you that QRS complex rather is embedded by the repolarization of the atria. So that is not being seen. हालांकि normally जब P wave है, that is the depolarization of the atria, उसके आगे उसकी repolarization भी होनी चाहिए. लेकिन QRS complex इतना जोरदार है, the depolarization of the ventricle is so much powerful that it masks the atrial repolarization, the record. Q wave is the first wave of this complex but often absent. अक्सर ये absent होती है. QRS complex, Q wave present the interventricular septal depolarization. ये बात याद रखने के काबिल है. Q wave stands for an interventricular septal depolarization, and its direction is ever from left to the right side. It's the first wave in the ECG with negative deflection. ये नेगेटिव वेव है. मैंने अर्ज किया था बेटे कि जो नेगेटिव वेव होती है बच्चों वो आइसोइलेक्ट्रिक लाइन या बेस लाइन के नीचे होती है. पॉजिटिव वेव जो होती है वो ऊपर होती है. Q wave greater than 1/3, the height of the R wave greater than 0.04 second are abnormal and may represent the old infarction. ये Q wave की significance है, already भी मैं बता चुका हूँ. Now, cardiac conduction system, ये देखिएगा. This is a figure which is illustrating you how the cardiac impulse, how the cardiac depolarization, from where it is being generated and how it is traveling and how it is encompassing the whole musculature of the heart. You are looking. SC node is the station from where this wave is being generated, which is known as a depolarization. And you are looking here, well, they are going to the atria, both atria, by internodal pathways. There are the internodal pathway, anterior, posterior, and lateral. These are the internodal pathways, and they all impinge on the AV node, atrioventricular node. And then from there, AV bundle. This is the AV bundle. Then the bundle branch. This is the left bundle branch, the right bundle branch, and then goes like the Purkinje fibers. And Purkinje fibers, they take the depolarization and they distribute to the whole musculature of the heart, in particular the ventricles. And you're looking here, these are the chordae tendineae of the यहाँ पे tricuspid valve, these are mitral valve, and they are attached here with the musculature. These are known as the papillary muscles. Papillary muscles, they are in the underlying walls of the ventricles. They are attached by these chordae tendineae to the papillary muscles, Purkinje fiber. This is the interventricular septum, the first to be depolarized. And Q wave is the wave which depicts the process of depolarization in the interatrial, the interventricular septum. Now, this is the pattern of the ECG wave you're looking here. Yes, again I show. These are the P wave, QRS complex, T wave, again P wave, QRS complex. And now you're looking here, this interval is known as a RR interval. It's a very beneficial for the evaluation of the regularity of the rhythm, whether the heart has got a regular rhythm or not. We measure it. The difference between two R waves is measured by a paper, blank paper, and we mark the lines. Then we take that paper, that line to this much. If that is matching, it means the heart is regular. If that is not matching, it means heart is irregular. So RR interval is a very much beneficial in order to evaluate whether the ECG has got a regular rhythm or irregular. Bismillahirrahmanirrahim. Now I'm talking on the various abnormalities of the QRS complex. QRS means the composite of a three waves Q negative, R positive, S again negative. The low voltage complex means dwarf QRS. When the height of R or S wave is not more than 5 millimeter, it is seen in hypothyroidism, pericardial effusion, thick chest wall, problem in ECG machine. In such patients which have got a hypothyroidism, which is called a pericardial effusion or the thick chest wall, you will attain the record of a low voltage QRS complex, the dwarf QRS complex. High voltage complex, on contrary, this is present in ventricular hypertrophies. The maximum voltage of QRS complex may be 35 millivolt or 35 small square, upright, perpendicular. V1 and V2 show high voltage QRS complex in right ventricular hypertrophy. S wave, V5 and V6 show such QRS complex in left ventricular hypertrophy. R wave. This is again, you can see here, you can look here, this is a vector and how it is going, the electric flow, transverse plane. As you are looking here, the S wave is a deep, S wave is a deep, R wave is a high, R wave is high, and you have to see the amplitude of these. This is the R wave, height of R wave, more than 35 millimeter. That depicts hypertrophy or high altitude, high R waves, and keep in mind high R waves are deep S waves that knows the hypertrophies of the ventricle. T wave, very much important wave. It represents the ventricular repolarization. ये वेव जो है, मैं इसे हमेशा कहा करता हूँ कि ये मनहूस वेव भी है. T wave is a manhus wave because its abnormality, T wave, it represents the ventricular repolarization. और होना चाहिए इसको downward, but it is ever upward. ये electrical flow of the current उसका mechanism है कि the last part of the ventricle being depolarized is the first to be repolarized. What's the reason? The last part of the ventricle to be depolarized is the first to be repolarized. That is why T wave becomes upright. और जब तक ये upright है तो ये नेक शगुन है. जो ही ये invert होती है तो that causes the multiple pathologies. Rather, you have got ischemia. It is repolarizing wave but shows the upward deflection because the part depolarized in the last is the first to be repolarized. That is the base of the heart depolarized in the last but is first to be. ये सबसे बड़ी बात है for the students to remember कि होना चाहिए इसको inverted. ये है upright. क्यों? It is the repolarizing wave but shows the upward deflection because the part depolarized in the last is first to be repolarized. That is base of the heart depolarized in the last but is first to be repolarized. T wave should not be more than 1/3 of R wave. R wave का 1/3 हिस्सा जो है T wave की height होनी चाहिए. The T wave inversion represent ischemia of the heart. What do you mean by the ischemia? That is the starvation of the blood. Blood is not going to the particular part of the heart having the settled quota. Settled quota, every tissue has got a certain numerical quota of the blood flow, and if it is not being fulfilled, then it is the ischemia. Ischemia means the starvation of the tissue regarding the supply of blood. It is a ischemia. Tall and peaked R waves is present in hyperkalemia. Hyperkalemia means when the potassium level is raised, there is a tall and peaked R wave in present. Flattened R waves in pericarditis and myocarditis. Pericarditis, the inflammation of the pericardium, and myocarditis, the inflammation of the heart muscle. Interval and segments with their pathologies. Anidium, which is the in between the lines, is well described in ECG. I have already told you. PR interval, This is from beginning of P wave to the beginning of Q wave. Its normal duration is from 0.12 to 0.2 second. It represents the conduction time of impulse from the SA node to the ventricles and AV delay. Prolonged PR interval, very much important. The students must note, prolonged PR interval shows delayed conduction from SA to AV node. In first degree hot, second degree and complete hot blocks, and in digitalis therapy and hyperkalemia, you will see the PR interval. It will be rather erratic. It will be delayed. And this is seen in the first degree hot block, second degree hot block, and a complete hot block, and also digitalization, digital therapy, digitalis, toxicity, and hyperkalemia. Hot blocks, very much important, and it is only the ECG which will help you to evaluate and to diagnose the various hot blocks. What I mean to hot blocks? That's the conduction defects. Because you are starting from pacemaker, sinoatrial node, then the internodal pathways, then the AV node, then the bundle of His, then the bundle branches, then the Purkinje fiber. If at any point block takes place, that means there is conduction defect. There are three types as follow: first degree hot block, second degree hot block, third degree hot block. First degree hot block, AV block, it is also known. First degree, atrioventricular conduction lengthened. The atrioventricular conduction lengthened. Interval is between 0.2 to 0.3 second. You are looking here. This is normal. It's increasing. And interval is 0.2 to 0.3. And what happens? In the case of a first degree hot block, the PR interval that increases. Second degree hot block, AV block or second degree hot block, sudden dropped QRS complex. Well, see, in this case, the pacemaker wave, all the pacemaker waves do not reach to the ventricular musculature. Rather, some waves are dropped at the AV node because of the block, and PR interval is about 0.4 second. QRS absent, you are looking here. QRS is no, P wave is there. QRS absent. Here the P is there, QRS is there, T is there. Again, यहाँ पर QRS is absent. That means the AV block, that is the second degree hot block. QRS is dropped, and you have to see if a ECG comes like that, the P wave is not followed by the QRS complex. It means a case of a AV block, atrioventricular block, or the second degree block. There are two types of the second degree hot block as follows: Mobis type 1, and also known as a Wenck-Beck periodicity, and Mobis type 2. This is the person, Mobis. Waldemar Mobis is a scientist who evaluated, who figured out these two types of the blocks, second degree block. That is why, in honor of his name, they are titled as the Mobis type 1 and Mobis type 2, and also Wenck-Beck phenomena. Mobis type 1, also known as a Wenck-Beck periodicity or Wenck-Beck phenomena, is defined as a type 1 block, is characterized by progressive prolongation of the PR interval until a ventricular beat is dropped, and is then followed by resetting of the PR and repeating of the abnormal cycle. The progressive prolongation of the PR interval until a ventricular beat is dropped, and is then followed by resetting of the PR and repeating of the abnormal cycle. Type 1 block is always caused by abnormality of the AV node. In most cases, it is benign and no specific treatment is needed. Mobis type 2, in type 2 block, there is usually a fixed number of non-conducted P waves for every QRS complex. For example, a 2-to-1 block implies that there are 2 P waves for every QRS complex. Rhythm. Well, I'm talking on the Mobis type 1 and type 2. You're looking here the graphical representation ECG records of the MBBS 1 or Wenckebach phenomena, the MBBS 2, and you are looking here the prolongation of the PR interval, and then the MBBS type 2, you are looking 2 to 1 blocks, 2 P waves, and then there is a 1 QRS complex. 2 P waves and a 1 QRS complex is a 2 to 1 block, which is the MBBS type. This is a third degree heart block. It's also known as Stokes-Adams syndrome. Stokes-Adams syndrome, and you are looking here the normal ECG and the third degree heart block. It means there is a complete dissociation of the sinoatrial node and the ventricular rhythm. Ventricular rhythm is all together at its own because this is excitable tissue, and every part of the heart has got a excitability, and because of that there is a separation, dissociation, disintegration. So many the stations, they are having their own loci, they have got their own rhythm. Third degree heart block, atrial fibrillation, ventricular fibrillation, they are all involved in third degree heart block. And third degree heart block, when there is a AV block, it continues to beat at normal rhythm, while new pacemaker develops in the Purkinje system with a rate of 15 to 50 beats per minute. With a sudden block, Purkinje system cannot take over pacemaker activity immediately. It takes about 16 to 30 seconds, during which ventricles fail to contract and person faint. The delayed pickup of heart beat is called Stokes-Adams syndrome. It's a presentation of a third degree heart block, and it is only possible by the ECG changes ECG record. Then the QT interval, measured from beginning of the Q to the end of the T wave. Beginning of the Q to the end of the T wave. This duration is about 10 small squares. It indicates total systolic time of the ventricles, total contractile time of the ventricles, how much time the systole takes place, contractility of the ventricles, that is the QT interval. PR interval, you are looking over here, is a PR interval. Well, start from the P to the start of the Q. And this is the, yes, RR interval. R, I have already told you, the distance between two successive R waves, QRS complex, and their ends, they are measured. These are RR waves. And I have told you already the rough procedure, that you can take a paper and you can measure the difference. You can take the ruler and you can measure the distance. You can also count the small boxes. You can count the large boxes between two successive R waves, and now compare in the whole strip of the ECG in order to declare whether it's a regular ECG or an irregular ECG. Again, for the revision, you're looking here at PR interval, the QRS complex, the ST segment, T wave, and U wave. It's a new feature. U wave, sometimes it is present and mostly it is not present. It's a slow repolarization of the papillary muscle. The U wave is caused by the slow repolarization of the papillary muscle. ST segment, this segment present between S wave and T wave, it represents the plateau phase. Its duration is 0.04 second. ST segment is a very much important J point, the exact point, very much important to know. Students, I must beg your concentration. The exact point at which all parts of the ventricles are depolarized, that is at the just end of the QRS complex and just at the beginning of the ST segment. That point is known as J, क्योंकि J point पर पूरे का पूरा ventricular musculature जो है depolarized है. No part is repolarized at this. और ये point कौन सा है? At the very end of the QRS complex and the very start of the ST segment. This point is known as a J point. It's known to be a reference point. At the point, potential of the ECG is 0. At the point, potential of ECG is 0 with no current is flowing through heart. J point. This is known as a J point. You're looking here, P wave, Q wave, R wave, and this is the J point. At the end of the QRS and start of the ST segment. very much important. This is your point. ST segment. Elevation seen in recent myocardial infarction. MI mean myocardial infarction and hyperkalemia. Depression seen in ischemia, digitalis therapy and hypokalemia. ST segment is very much important. You're looking here. Well, this is not down sloping of the ST segment. Yes, नीचे गया. This is the uplifting और यहाँ पर बिल्कुल horizontal हो गया ST segment. The J point occurs at the end of the QRS complex. The ST segment begins at the J point and extends to a user defined interval. ST segment depression देखिए. This is the depression, down sloping. ना इसकी दोस्ती अच्छी ना इसकी दुश्मनी अच्छी. ये depressed भी अच्छा नहीं है और elevated भी अच्छा नहीं है. It should be lying just on the isoelectric line. It is, if it is raised, it is pointing towards infarction. If it is depressed, it is showing ischemic change, the cardiac injury. Ischemia and S-T depression, you are looking here. Why? Well, you are looking here. It's a normal. P, Q, R, S. ये आप देखें नीले रंग का जो है, ये ब्लू जो है, ये ST सेगमेंट है. इट्स आइसोइलेक्ट्रिक. लेकिन अगर यहाँ पर आप मुलाजा फराएं बेटे, तो यहाँ पे डिप्रेस हो गया. देखें ये लाइन है इसकी नॉर्मल. ये 1, 2, 3, 4, ये 4 स्मॉल स्क्वायर्स नीचे चला गया. डिप्रेस्ड एंड डिप्रेस शोज इस्कीमिया. व्हाट डू मीन बाय द इस्कीमिया? कि जैसे किसी ग्रासी प्लांट को पानी नहीं मिलता, तो जितने प्लांट को पानी नहीं मिलेगा उसकी घास विदर आउट हो जाएगी, सूख जाएगी. इन द सेम मैनर्स दैट पार्ट ऑफ एनी टिश्यू विच इज नॉट बीइंग सप्लाइड बाय द ब्लड, that is going to be ischemic, and in the same manner ischemia is being announced by the ST depression.